This is the upper limb tension test. This test is used to test the ulnar, median and radial nerve within the upper limb to see if we have any tension or adhesions anywhere along the pathway. So this test is quite provocative, so it's really important to stage the test and check in with your client as they move through as well. So the first step that you need to do is get your client to laterally flex their neck away from the side of pain. So you can either move it for them or you can get them to take their ear to their left shoulder, in my case here. Next thing you need to do is take their arm or side of pain. Make sure that arm is relaxed at this point. What you want to then do is actually come and compress the shoulder down. So using that elbow, come and compress the shoulder. And then the best thing to do is actually wrap your arm underneath to be able to hold their elbow with your hand. At this point, you want to check with your client that there's no numbness, tingling, altered sensation or pain anywhere from the neck all the way to the fingers. If they're doing okay in this position, what you then need to do is come through and add the arm portion. So first of all, I'm going to start with the ulnar nerve. So what you need to do is come into this portion. Make sure you actually grab it onto fingers as well, because we need full extension of that nerve. So make sure you maintain pressure on the shoulder and then actually come out into the median nerve pathway. In that portion, if the client feels pain at any section, what you want to do is stop there, get them to bring their neck back to center to see if it relieves their pain. If that relieves their pain, it's likely in the spine or the actual spinal cord rather than in the periphery. So that's our median nerve coming out into that portion. Ulnar nerve is actually coming back towards the ear. So making sure we're placing pressure onto the little finger at this point and bringing all the way back in towards the ear. The very last one is the radial nerve, which you need to come back to the opposite side for. Still making sure the neck is in cervical lateral flexion. This time you need to decompress or compress the shoulder from behind. Best is to actually come use your cubital fossa to be able to compress that. What you then want to do is have the client's arm in 90 degrees flexion. Then you want to actually pronate the arm. Get your client then to put their thumb in a fist and get them to hold that for you. Then what you want to do is grab onto that fist and move it into a flexed wrist position. Then you can extend the arm out. And again, if they feel pain in that region, just get them to bring their neck back to center. A positive result in this test is any numbness, tingling, altered sensation or pain anywhere from the neck all the way to your fingers or replication of their symptoms.